Hi, this video is for the hand washing procedure. For this checkoff, you will have to complete this at 100% level of accuracy. So I recommend memorizing the sheet just so you can verbalize this all to us. We can observe you washing your hands, but we need to know that you know what you're doing as well. Okay, so first you're going to state the rationale, which is hand washing is the single most important behavior in the prevention of disease transmission in the healthcare setting. Second, it must be emphasized that the antiseptic hand washing technique should be done before the first patient, after lunch, immediately after skin contact with blood or body fluids or contaminated objects, and then immediately after glove breakage. Okay, next I'm going to be removing all of my jewelry. So if you have a silicone band or just a single wedding band, that's okay with no jewelry on it, no jewels on it. And then a watch can be still used in clinics, so I'd recommend just kind of pushing that down so you can properly wash your hands. Okay, then I'm gonna wet my hands and wrists with cool water. Okay, I'm gonna use a foot pedal so we're not touching handles, right? Okay, rinse. And then I'm gonna be applying antimicrobial soap. We do not want to use bar soap as that can become contaminated. Okay, so this procedure is going to be 15 seconds. I'm going to massage the soap onto my palms, the backs of my hands, both hands. I'm going to be interlacing my fingers. I'm going to be doing my knuckles, my nail beds, my fingertips on both sides, knuckles, nail beds, fingertips. I'm going to be going around the thumb. Okay, and then my wrists. Again, this procedure should take 15 seconds, okay? And then after this, for this antiseptic technique, I'm going to be using my toothpick to clean underneath the fingernails. And a lot of bacteria is found under that first millimeter or two under your fingernails. Just be using the toothpick to clean underneath each nail. And this procedure is not included in the routine hand wash. So again, this is for the antiseptic technique. After that, I'm going to be rinsing my hands and wrists with a stream of cool water. I'll toss that toothpick in the trash can. Okay, after all the soap is removed, I'm going to use a disposable paper towel to make sure that my hands are completely dry. I would dispose of those paper towels in the trash can. Okay. Once the hands are washed, do not touch anything that has not been disinfected. If cross-contamination occurs, like if you touch your hair, touch your mask, itch in your nose, or anything like that, you are going to have to deglove, wash your hands again, and then reglove. And then that also goes with if you are going to you have an itch, you want to remove your gloves, wash your hands, and then you can itch. So routine hand washing should be performed before and after patients, prior to glove placement, after glove removal, and before leaving the operatory, and before touching your eyes, nose, or mouth. Again, so that little last blurb, number 11, is for the routine hand washing. And that beginning part, along with the toothpick cleaning, is done in the antiseptic hand washing technique.